Hello and welcome to Sky News Breakfast. Thousands of paramedics, call handlers, emergency care assistants and technicians in England and Wales are on strike today. The military has been drafted in to help provide emergency cover, but NHS leaders warn the public mustn't take risks with their safety and only call 999 in a life-threatening emergency. The Health Secretary, Steve Barclay, has accused unions of making a conscious choice to inflict harm on patients. We'll be speaking to him in a few minutes' time. Well, unions say that Mr Barclay has been intransigent, refusing to negotiate over pay. Let's bring in our correspondent Dan Whitehead, who's joining us now live from Bristol. Good morning to you, Dan. So what's the situation where you are?
Well, across most of England and indeed Wales, picket lines are starting to form as this strike by ambulance workers gets underway. We're at a picket line which is being organised by one of the three unions that's carrying out this strike action today. This is the GMB union. More than 10,000 workers, part of that union, and ambulance services across 9 ambulance services are on the picket lines today. And we can have a quick chat with the GMB union rep who is on the picket line here, Tim Northover. Thanks for speaking to us on Sky News, Tim. First of all, just quickly outline the main problems that the people you represent are facing in the ambulance service.
Well, first of all, they've faced over a decade of real terms pay cuts, but this is very much about pressures that they're facing day in, day out in terms of the service. So the service has been subject to cuts. We're currently facing the highest levels of vacancies in the service, the worst waiting times at A&E departments. Our members can't do their jobs effectively because they often find themselves stuck outside A&Es all day, unable to hand over patients to the hospital.
Is pay the major factor here? Is there a percentage of an increase in pay that your members would be happy with?
Well, the government have imposed around about 4% on average for our members, which is, again, below inflation. Even prior to this year, our members have suffered real-term cuts of up to 15%, lagging behind. So we want to keep at least at pace with inflation, absolutely.
You're asking for an inflation or above pay rise.
Absolutely.
Are you actually expecting that in the current climate?
Well, it's affordable. I haven't seen any data to suggest that a pay rise for these essential workers will damage the economy.
And very quickly, it's right that your guys are still signing in at the ambulance station round the corner, aren't they? They will respond to what sorts of incidents?
Yeah, so the members that the GMB represent do this job because they care deeply about people. So we're very cognizant of our responsibilities to provide life and limb cover. So what that looks like is that our members will sign in, register as per normal, and respond if necessary from the picket line for essential calls.
Appreciate your time, Tim. Thanks so much.
Thank
We'll be
you.
speaking to you and your members throughout the morning. Quick word on the Welsh Government. It is urging people not to call 999 unless it is an absolute emergency. Clearly, services throughout today across England and Wales are going to be impacted.
All right, Dan, in Bristol for now. Now, we have got correspondents across the country covering this for us. Fraser Maud is in Burnley and Aisha Zahid is in Oxford for us this morning. First to you, Fraser. So tell us what's happening up in Burnley, how the striking workers there facing up to this morning.
Yeah, here in Burnley, 3 unions involved in this industrial action. Unite is one of those. All the Unite members here in the Northwest are on strike today. So obviously services will be pinched. This is an unprecedented time of pressure on the service. I was talking to one ambulance service yesterday. They were saying that a couple of days ago they had the busiest 24 hours of the year in terms of the number of requests for ambulance call-outs, and those waiting. So a lot of people left waiting, and more people are going to be left waiting, perhaps even longer today because of the industrial action. Could talk to the Unite representative here, Keith Hudson. 4% has been offered. The government think that's enough. Clearly, your members don't.
No, I mean, given the fact that inflation's running around about 12%, and given the fact that there's been cuts to pay every year because it's never met to inflation levels since 2010, people need a pay rise. It's as simple as that.
And in terms of the terms and conditions as well, I mean, we've been hearing for some time now about the pressures that the ambulance service is under. What sort of pressures are you facing? What are the biggest bugbears that your staff face?
Well, because of the way that the pay has gone, people have just left the ambulance service. So qualified, heavily qualified people have just said, well, it's not enough, it's not worth it for the money. So they've left in droves. So the staffing shortages are unbearable. So you look at the staffing levels now compared to the staffing levels, say, 8-9 years ago, there just aren't the qualified staff. You know, it takes 5 years to train a paramedic. They don't just come off the production line after about 10 minutes. They're qualified, heavily trained medical professionals here. You know, you just don't get them off a production line.
Okay, Keith, thanks very much for talking to us. So the situation so bad that people are choosing to leave the industry, going into private health sector, going into perhaps less skilled jobs. The pickets will be forming here throughout the day, a 24-hour strike here, as in many parts of the rest of the country, and people are being advised not to take any unnecessary risks, not to dial 999 unless it's an absolute emergency.
The advice, Fraser. Thank you for now. Let's bring in Aisha Zahid, who's also joining us live. Aisha, good morning to you, and I understand that you are in an area where a critical incident has been called.
Yeah, that's right. South Central Ambulance Service is just one of several that have declared critical incidents. And these are separate from the strike action, most of them declared yesterday. It also includes South East Coast Ambulance Service, East of England, North East and Yorkshire Ambulance Services. What exactly is a critical incident? Well, it's an internal notice issued, which means that priority is then refocused on those patients who are the most ill. It comes about due to demand. It's come about here because they faced unprecedented levels of demand over the past week, and that's paired up with hospital handover delays, which doesn't help. So to give you some context in numbers here, well, at the same time last year compared to now, 999 calls have increased by 50% and 111 calls have increased by 75%. They've described the pressure over the course of the last week as being extreme. So the message really is to only call 999 if it is a life-threatening situation, because of course it won't be helped by the strain felt by this strike action.
Aisha, Fraser and Dan, thanks all. Now, if you scan that QR code that you see right now at the bottom of your screen, that's going to take you to our website where you can find out how the strikes are affecting your area. Well, nearly all of the morning's newspapers are leading with the strikes, as you'd expect. The Financial Times goes with warnings from NHS leaders that patient safety cannot be guaranteed during these strikes. Those safety concerns are also the main focus of the Eye. The Guardian echoes the message of NHS bosses, saying that they are now asking for the Prime Minister to enter negotiations. The Telegraph focuses on the Health Secretary Steve Barclay, saying that unions are consciously making a decision to inflict harm. The Metro headline, "You'd better watch out," while the Times goes with this: "Avoid taking risks, public told, as paramedics strike." The Star says that the advice over what to do and what not to do amounts to wrapping the public in cotton wool, while the Sun says, "Don't have fun." Now, the Mail asks a question to NHS staff who are on strike, saying, how will they live with themselves if people die today? The Mirror uses the struggle of NHS staff on strike to offer a comment on the Conservative peer, Michelle Mone, while the Express tells us that military is being deployed, but as you can see, their main story is about the Christmas post-royal fail, they say. And to remind you that just after 7:10, so in a couple of minutes' time, we'll be speaking to the Health Secretary, Steve Barclay. Then we'll be speaking to the GMB's National Secretary, Rachel Harrison, at around 7:30. Now, Ukraine's President Volodymyr Zelensky is on his way to Washington. He's set to meet with Joe Biden at the White House and make an address to Congress. It'll be the first time that Zelensky has left the country since Russia invaded 10 months ago. Let's bring in our international affairs editor, Dominic Waghorn, who's joining us now live. Good morning to you, Dom. So, surprised by this, are we, that Mr. Zelensky, President Zelensky, is on his way to DC?
Well, I think for the last day or so, it's probably been the worst-kept secret in this war. And we understand President Zelensky agreed to go a few days ago, but it is now confirmed he is on his way. He said so on Twitter. And I think it's a very big moment in this war. He's taking a risk, a security risk. You wouldn't want to overplay that. The fact is world leaders have come to Ukraine and gone, and he's in the same way able to go and then come back. And it's not as dangerous as what he did yesterday, but he went to the most dangerous place on earth, probably, Bakhmut, the town in the east, in the Donbass we went to a few days ago. The sound of constant shelling when we were there, and despite that, he went there, went to the front line, met the troops fighting on the front line, and he received a Ukrainian flag that many of those soldiers have signed. Now, he said he's going to take that to Washington as a hint to Americans, to their leaders, that Ukraine needs more, and he's going there to press the need for strength and resilience. And I think it will be seen in the same light as what Winston Churchill did in the middle of the darkest hours, really, of World War II. In 1941, he took the risk of flying to Washington, and he also addressed both houses of Congress and met the president then. And I think Zelensky will be using this visit to underline the need that Ukrainians feel that the West, despite the billions of aid they've been given, the huge amount of military weapons, still need more. And the sense here that the West has, in particular, underestimated the damage that Vladimir Putin can do to the civilian infrastructure, to the power supplies to Ukraine. We've driven through one major city after another, plunged into total darkness, hospitals threatened by the lack of electricity. Ukrainians are going to freeze to death in great numbers in their homes if more isn't done to help them during what will be a very cold, miserable winter. So he's going to be asking for more aid. He's going to be pressing members of Congress to support the $37 billion worth of aid that is currently in legislation going through Congress. And I think he will hope to see off some of the grumblings we've seen on the right of American politics about how much help America is giving Ukraine at a time when ordinary Americans are suffering and need help too. I think we shouldn't overestimate that, but I think this visit will be used by the Ukrainians and his supporters in America to head off that kind of opposition as this brave, plucky Ukrainian leader goes there and presses his case in person for more help for Ukraine during this war.
OK, Dominic, for now, thank you very much for that. All right, let's return now to the strike action taking place today, with thousands of paramedics, call handlers, emergency care assistants and technicians in England and Wales walking out in a dispute over pay. Let's bring in the Health Secretary, Steve Barclay, who's joining us now live from Westminster. Good morning to you, Secretary of State. Thanks for being with us this morning. First, let's just try and clear this up. What's your advice to the public today if they need to call 999 and want an ambulance sent?
Well, it's to use their common sense. The system will be under very severe pressure today. The trade unions have refused to give national exemptions in terms of all life-threatening and emergency calls. They've said that they will prioritise those, but it'll be down to local agreements with trust and indeed some decisions taken in call centres. So the system will be under significant pressure, and therefore we're saying to the public to exercise their common sense in terms of what activities they do, being mindful of the fact that there are those pressures on the system.
Should local decisions, are they not the best ones to take rather than having a national plan? Is that one of your concerns? There is no national contingency plan in place. Isn't that your job?
Well, the difficulty of putting contingency measures in place is given the uncertainty as to what exactly is and is not being covered, and the fact that those decisions in some cases will be taken on the day. But it's also the case that even what's referred to as Category 3 urgent calls are often very serious as well. So we're doing all we can with NHS colleagues to put in place contingency measures. We've got the army, we've got volunteers, we've got community services, we've got frail elderly services in terms of people that might fall. So there's a range of measures from a contingency perspective that we've been putting in place, but there's obviously limits to what that can be done. And therefore it is down to the trade unions in terms of what exemptions they provide. And the concern is particularly if services are taken from the picket line, that adds further confusion on the day and potentially delays responses.
Secretary of State, you said in your piece this morning in the Telegraph that the only way to resolve this is by talking. The unions want to talk to you, they keep saying that, but they want to talk to you about pay. So why won't you do that?
Well, we have a process in terms of pay, an independent process, and we've accepted the recommendations in full, and that looks at both the pressures on the NHS and indeed at the autumn statement, additional funding was targeted to the NHS. The Chancellor allocated an extra £6.6 billion to the NHS, but he also put in place the biggest ever increase in social care funding, an extra £7.5 billion over the next 2 years, and that recognises, particularly for paramedics, one of the biggest issues raised with me when I was talking to ambulance staff on Sunday evening. Actually, what they said to me was more important than pay was the frustration around handover delays at hospitals, and they're often caused by the delay in getting patients out of hospital who are fit to be discharged. That's why the Chancellor invested the extra £7.5 billion in social care, an extra 200,000 social care packages. So we're investing in the NHS, we're investing in social care, and I don't want to divert money from those essential services focused on patients to overturn what has been an independent process which has looked at what is affordable to the economy, what is affordable to your viewers at a time of cost of living pressure, but also recognising the system's under very severe pressure and we need to get that extra investment into the NHS and into social care.
We'll come back to some of the points you make there in a moment, Secretary of State, but I just want to read you what's been said by the NHS Providers and NHS Confederation yesterday. They said that the fear of NHS leaders is that the risk to patients is only going to get worse with future strikes planned. That is, unless the government is able to reach agreement with the trade unions to bring a swift end to the dispute. Now, that's not the unions saying that, that's not nurses saying that, that is the NHS providers. And this is on the government, on you, to come to an agreement.
Well, we have, as I say, accepted in full the pay review body recommendations, but that's in addition to last year.
Sorry, Secretary of State, let me just interrupt you there, sir. I'm sorry to do that, but you always talk about the pay review bodies, and you know, as well as I do, that the pay review body is not always listened to. Back in 2014, the pay review body recommended a 1% increase in NHS pay. That was rejected by the now Chancellor, Jeremy Hunt. In 2018, police officers were recommended a pay review increase of 2%. That was rejected as well. So you can make a decision to not listen to the pay review body. Why are you not doing it in this instance?
And when we have done that, you have been the first, I'm sure, to criticise us for not respecting the independence. The difference here is we have accepted those recommendations in full because we recognise the system coming out of the pandemic has been under pressure. So we have accepted the recommendations in full. And that comes on top of last year when the rest of the public sector had a pay freeze. We prioritised the NHS with an extra 3% rise when many other people were facing a pay freeze. So we have prioritised the NHS. We've accepted in full the independent pay review body's recommendations, but we've gone further and we've put an extra £6.6 billion into the NHS and the record funding into social care because we recognise the huge strains the NHS is in as a consequence of the pandemic. And it's important that we focus on those patient services to clear the backlogs in operations, to address the handover delays, to get the support into primary care for GPs, because that's where the system is under most pressure.
Let me put it to you like this then, Mr Barclay. Without having staff in the health service because they're not being paid, they're not working in the right conditions, you won't be able to improve those services and treatment outcomes.
Well, pay is a factor. I mean, the basic pay of a paramedic, the average pay of a paramedic is $34,300. But when you add in overtime and unsocial hours, that's an extra 37%, takes it up to $47,000. On top of that, you get a 20%, a fifth, going into pension as well. So we have listened to the recommendations of the pay body on pay, but pay is just one of a number of factors. We also look at the fleet. We're investing in more ambulances. We're putting more money into ambulance trusts, an extra £150 million. We're also investing in call centres because we're seeing very significant increases in pressure on the number of calls that ambulance trusts are facing. So we put an extra £50 million into that. And as well as that, we recognise there's a particular issue in terms of the elderly, those elderly people that fall, the need to get services to them. That's why we've been working with partners like St John's Ambulance, an extra £30 million in to get St John's Ambulance targeting those elderly falls. So we're investing more in the system. We're doing that within the context of an independent process that looks at pay, but it's also important that we tackle some of these system pressures, particularly around social care. That's why we put the record funding into that, and that in turn has a very big impact on paramedics.
That is going to take a while to feed through, as you well know. Now, you mentioned in the Telegraph today that striking workers are taking a conscious decision to put patients at risk. That's not conciliatory language. That's not going to bring the two sides closer together. That's only going to harden the side against you, isn't it?
Well, it is just a reflection of fact. The trade unions have chosen this time for the strike. We saw over the last week a 73% increase in flu admissions to hospital. We saw a 27% increase in COVID admissions. We've got 5 times the normal prescribing rate of prescriptions for antibiotics in terms of strep A. We've had a massive increase in calls to 111, up by more than a third. We've got an increase in calls to 999 over the last month of 15%. events. So the system is facing very significant pressures as a result of flu, of COVID, of strep A. And it's at this time that trade unions have not only chosen to strike, but have refused to put in place national exemptions to say they will cover all of the life-threatening and emergency Cat 1, Cat 2 calls. That in turn makes the contingency measures much more difficult to plan.
Secretary of State, and I'm sure the unions would say that they're not putting patients at risk. You're actually putting patients at risk by not being willing to discuss their pay requests. Now, this has been solved in Scotland by meeting the pay requests of striking staff there. Would the government go to something like that, 7.5% for nurses, to try and resolve these strikes?
Well, one of the big misconceptions about the deal in Scotland, and incidentally, the GMB were opposed to the deal in Scotland. They're one of the trade unions that are striking. But it wasn't simply 7.5%. If you add in all the other measures in terms of reducing hours, extra annual leave, changes to the way overtime is addressed, protected learning time, actually the cost of that is much more significant. And as I say, one of the trade unions has rejected that as well. But what we want to do is focus on patients, get that investment into the NHS, into social care, address the blockage. There are patients that are ready to leave hospital who it's not in their interest to stay. So get that social care and flow working. That is what we prioritised. And we've done that whilst also listening to what is an independent process around the pay review bodies. We've accepted those recommendations in full, and that builds on the extra 3% we awarded last year at a time when other public sector workers faced a freeze.
OK, Steve Barclay, thanks for being with us. All right, it's time for a look at what the weather has in store for the next couple of days. And I don't think we're going to have a snowy white Christmas as many people would have liked. Let's bring in our meteorologist, Steph Golter, who's joining us now live. So, Steph, how's it looking?
Well, if we wanted a white Christmas, we should have moved it to last week, and then we would have seen some snow in many places, and it certainly would have been cold. That would have given us the whiteness or the frost and ice around. But as it is at the moment, we've got an area of low pressure to the northwest that's sucking up a load of very mild air, but it is looking like it's moving.
We seem to have lost the line to Steph there. Steph, I bet it's not the snow that's stopping you being able to connect to us. Steph, can you hear me okay?
I can hear you fine.
Oh, excellent. We lost you for a second.
Should we have a look at the... OK, so I was just saying that we did have lots of white weather last week, but unfortunately now we've got an area of low pressure to our northwest that's sucking up a load of very, very mild air. So it is just looking a bit soggy for many of us currently. It looks like that low pressure's moving away, though. So maybe for Christmas, some of us might see some wintry weather, but I don't think many of us. Let's have a look at the forecast for today.
Warm memories wherever you go. The weather, sponsored by Qatar Airways.
So we've got our area of low pressure up towards the northwest then. That's making sure things are very, very windy for many of us in the northwest. And it's also bringing in plenty of showers. Some of those showers are heavy in the very northwest. Some of them are also with thunder too. And over the highest grounds, we're seeing a tiny bit of snow. Further south, where we have glorious blue skies yesterday, we're seeing more in the way of bands of rain, and those are tracking their way southwards. There's not one here in Winchester at the moment, but there are plenty of them around. They're working their way southwards, but in between them, there is some sunshine, and wherever you are, it is mild at the moment, with a top temperature today expected of 12.
The weather, sponsored by Qatar Airways.
All right, thank you very much, Steph. Now, millions of people were out on the streets of Buenos Aires last night, hoping to catch a glimpse of their World Cup champions. Many managed to see the squad as they drove by on an open-top bus, but the parade was eventually suspended after fans were seen doing this, jumping, there you go, from the bridge to get on board. The world champs were then transferred to a helicopter and flew over the parade route. Now, it is reported that the festival atmosphere changed as the evening went on, with some in the crowds clashing with police. Now, a standoff started when officers began arresting fans who had broken into the obelisk. Stones and glass bottles were thrown at the police, who responded with rubber bullets and mortar cannon. Hello, you're watching Sky News Breakfast. Our top stories this morning. Thousands of ambulance staff are on strike today. Earlier on this programme, the Health Secretary accused workers of walking out when the NHS is already under pressure and said that he will not be negotiating over pay. Ukraine's President Volodymyr Zelensky is preparing to travel to Washington, where he's expected to meet President Biden. And the Scottish Parliament is expected to give final approval today to legislation making it easier for people to legally change their recorded gender. Let's get more on those ambulance strikes. A few minutes ago, the Health Secretary told me that the walkout by ambulance staff would cause significant strain on the NHS. He also held firm on his position that the government will not talk to NHS workers about pay.
Trade unions have chosen this time for the strike. We saw over the last week a 73% increase in flu admissions to hospital. We saw a 27% increase in COVID admissions. We've got 5 times the normal prescribing rate of prescriptions for antibiotics in terms of strep A. We've had a massive increase in calls to 111, up by more than a third. We've got an increase in calls to 999 over the last month of 15%. So the system is facing very significant pressures as a result of flu, of COVID, of strep A. And it's at this time that trade unions have not only chosen to strike, but have refused to put in place national exemptions to say they will cover all of the life-threatening and emergency Cat 1, Cat 2 calls. That in turn makes the contingency measures much more difficult.
Harrison, National Secretary of the GMB Union, representing ambulance workers. Rachel Harrison, good to have you with us this morning. So the Health Secretary says that unions are making a conscious decision to put patients at risk. Is that what's happening?
Good morning. No, I actually think that's a really insulting statement to our key NHS and ambulance workers. They've not made a conscious decision to put lives at risk. They've made a conscious decision to stand up for what they believe is an NHS that is crumbling beneath their feet. And as they're watching thousands of their colleagues leave the service every year because of poor pay and poor working conditions and a feeling of being unable to deliver the safe standards of patient care that they want to. That's why they're making this conscious decision, and it is insulting to say that they're doing this to put people at risk.
And as you will have heard, the Health Secretary said that hundreds of millions have been invested in the NHS to try and solve the backlog. He's saying that that should be enough and that striking workers really need to get back to work.
Well, we have to understand why there's such a significant backlog. And one of the crucial reasons for that is the 133,000 staffing vacancies that there are across the NHS. There are literally not enough staff working in the NHS to deliver on those services. And without an investment now in the workforce that we have got now, recruitment initiatives are pointless. We need to do everything we can to protect our NHS workers that are working in the system right now. And that could be anyone from porters and patient transport services to paramedics to nurses. We need to invest in this workforce now.
Now, the GMB, as I understand it, Rachel Harrison, haven't put forward a pay demand. Why is that?
Well, what we asked for when we entered into the pay review body process in good faith earlier this year was a significant increase in pay, plus a commitment and a credible plan to restore a decade of lost earnings and an immediate down payment on that. So that's what we were asking for, and that is what we would still like to see. But what we're saying to the Secretary of State and to this government right now is come to the table, talk to GMB, talk to the other health unions and make us an offer on pay that we can take back to our members.
I mean, as you will have heard, the Secretary of State is unwilling to talk about pay. So does that mean these strikes are just going to go on?
Our members are the ones that will decide what any future action may look like. But it's in the Secretary of State's hands to end this dispute now. And by this government refusing to speak to the unions about pay, it is them that are choosing that this dispute will continue.
Just a last thought from you, Rachel, if you can. How much longer on the mandate from this first vote have your members got for the strike action? When do you have to go back to them?
Under the trade union legislations that are currently in place, unions have 6 months from securing a ballot result for action to take action. If the dispute continues longer than that, we have to run another ballot.
OK. Rachel Harrison from the GMB, appreciate your time this morning. Thank you.
Thank you.
All right, let's bring in Amanda, our political correspondent. Amanda Akas joining us from Westminster. Amanda, good to have you back with us. So we've seen there the Secretary of State sticking with his position that he will not be discussing with the unions about their pay demands.
Yes, indeed. And I think what we've heard there from the two sides of the dispute is that, if anything, they're as far away as they have ever been. We heard Steve Barclay accusing the unions of taking a conscious choice to inflict harm on patients. And earlier he was telling you that they have made a choice to strike at this time of year when the NHS is under its most significant strain as a result of flu, COVID, Strep A, and a higher than usual rate of calls to ambulance services and 999. He also criticised the lack of what is called a national exemption to the most urgent calls. This basically means agreeing on paper that across the country, Category 1 and Category 2 calls will always be answered. The union's response to that is that they've made agreements on a local level, so that is not necessary. They've also accused the government of being scaremongering and misleading in the way they've talked about this lack of a national agreement. And indeed, we just heard there the GMB union saying that the government is being extremely insulting to NHS workers by refusing to come to the table and discuss pay at all. The government's sticking to that fairly intractable line that they are sticking with the findings of the independent pay review, giving workers around a 4% increase. The nurses, of course, asking for a 19% increase. Ambulance workers saying that they deserve something above inflation. They're not putting a specific figure on it, saying that they want to negotiate, and the longer this goes on, the government will be under more pressure to do so, I think.
Okay, Amanda, for now, thank you. All right, now to the most significant and perhaps controversial legislation passed by Nicola Sturgeon since she became First Minister, making it easier for people to change their legal gender. The Scottish Government wants to simplify and speed up the existing process. Unlike at present, no formal diagnosis of gender dysphoria or medical reports would be required. The period in which applicants need to live in their new gender will be cut from 2 years to 3 months, or 6 months for 16 and 17-year-olds who will now be allowed to obtain a gender recognition certificate. Previously, the age limit was 18. Well, joining us now from Edinburgh is the SNP MSP, Karen Adam. Good morning to you, Karen, and thanks for being with us this morning. So just explain to us why the Scottish Government is attempting to change the law here.
Well, it's not actually giving trans people any more rights. What it's doing is simplifying a process that's already in place to ensure that trans people can obtain a gender recognition certificate. It demedicalises the process. It takes away the need for strangers on a panel to make decisions about an individual that they've never met. And this is, in fact, a really good news story. This is progression in Scotland, making it a more fairer and equal place to live. And that can only be a good thing.
Let's explain to us why it's important to take medical professionals out of this process, because this is obviously a hugely significant decision that an individual could be making.
Absolutely. There's no need for this to be medicalised. Trans people know their own minds. They know and understand what they want to do with their lives. They have bodily autonomy, and that should be honoured, absolutely.
I mean, how do you answer the criticism that this clarification of the legislation, as you put it, is in fact harmful to the rights of women?
Absolutely not. There's no way that women's rights are going to be impacted by this. I'm a woman myself. I'm an intersectional feminist. And this, in fact, is good for feminism overall. It's good for women because this is progression away from archaic systems. And of course, we'll have to remember that trans women are women as well. And we're all in this fight of feminism together. There should be no conflation with anything else. This is about trans people and a process to simplify them obtaining a gender recognition certificate to live their lives with dignity and respect.
But just staying on the rights of women, this decision has been criticised by the Special Rapporteur on Violence Against Women and Girls from the United Nations. I mean, she's an expert in the field and she's concerned about the changes.
Well, I'm a member of the Equality, Human Rights and Civil Justice Committee, and we had an evidence session on Monday, which we were able to speak to two of the UN specialists, and Victor was there as well. And I did ask her probably about 3 times to ask why she changed her mind away from supporting the model of self-ID and simplifying the process for trans people. But what she did was write a letter to Bulgaria in 2021 asking them to do that. After 3 questions, I really couldn't quite get to the bones of the evidence of to why she would have changed her mind. And Victor himself had provided quite a lot of evidence-based facts. So for myself, for the other members of the committee, for the months of time we've taken on evidence sessions on this, I'm very satisfied that there is no threat to women and girls, absolutely not. And it shouldn't be conflated with that.
Yeah, it's not just disagreement in the UN, though. It's disagreement within your own party, isn't it, as well, Miss Adam? But also, let's just go back to the idea of a 16 or 17-year-old making such a huge decision on their lives. I mean, I remember what I was like at 16. Is it really the time to be making such huge, profound, life-changing decisions without the support of professionals?
Yeah, well, I mean, just to pick up on the other members of the SNP group, it's a very small vocal minority, and that is down for them to answer for that. We were elected on a manifesto commitment twice to pass gender recognition reform. We took evidence from the Scottish Children's Commissioner, who advised that lowering the age to 16 and 17 would be a good thing. We're talking about people who are going to be transitioning out of schools, academies, into perhaps the workforce, into further education, and to be able to have a certificate in their gender and with their name that they want to be called by is crucially important for them and for their mental health, and for them to be able to take part in society as the person that they know and want to be.
OK, Karen, Adam, appreciate your time this morning. Thank you.
No worries, thank you.
All right, this is Sky News Breakfast, and still to come, we'll take a closer look at some of the stories making headlines in our paper review. All right, time for a look through the morning's newspapers now. I'm joined by the journalist and author Janelle Aldred and by the academic and writer Joanna Williams. Joanna, Janelle, good to have you both back with us. Let's dive straight into this, and we're going to a story that you've picked out, Joanna, or rather reporting you've picked out, inside pages of the Daily Mirror. Let's just bring up, it's a double-page spread, and this is all about the pressures on the NHS, hell on the 999 front line. Tell us about this.
Yeah, I think this is a really important story that the Mirror's covering here, and it's actually taking us beyond the issue of pay in terms of what these strikes are about. And sadly, some of these stories we have become familiar with of pensioners who take a fall and are then left cold on the pavement, perhaps even outside, for very, very long periods of time. And this is about paramedics arriving too late. I mean, it's really tragic, arriving too late to patients who've called for an ambulance, or their relatives have called for an ambulance, and the pressure that's placed on paramedics, who then have to turn around and explain to relatives that they're terribly sorry, but there's just nothing they can do. And I do think this is important for a number of reasons. I mean, mainly because it shows us that these strikes are about more than just pay. They are about the conditions in the NHS as well. But I actually think it's really important that there is a bit of more of a national conversation really about what is going on in the NHS, other than, as we say, just the issue of pay. We need to look at why patients who are clinically well are not able to be discharged into care homes. We need to look at where the money is going within the NHS, I think, because if you compare the money that goes into our NHS with other countries in Europe, we don't actually fall that far behind. We don't have the lowest rates of funding, and yet we do have worse outcomes in a number of areas. My concern is that we have far too much bureaucracy, far too many managers, far too many people who are working in backroom roles who don't necessarily contribute to the health of patients on the front line. Now, clearly some of those are going to be very important. I'm not suggesting we ditch all managers in the NHS, but I think actually having a proper conversation about what we expect of the NHS and how it can serve the country better, I think is absolutely vital.
Thank you for that, Joanna. And Janelle, you're picking up a story inside the Telegraph, and this is about some of the services that may well be lost as a result of these strikes. Tell us about this.
Yeah, so one of the things that is being lost is home births are being scrapped because of transport fears that if things go wrong when someone's having a home birth, then they wouldn't be able necessarily to get an ambulance to get them to the hospital quickly and safely. I'm an ambassador for SANS, a Stillbirth and Neonatal Death Society, and of course, in moments like these, and it's hard because it's a choice that women want to make for themselves about where they give birth, how they access healthcare, and that is being taken away. And there are things being taken away, and it does feel hard. But as we spoke about in the last hour, the point of strikes are to be disruptive. The point of strikes are to push the point home that the way things are working are not working. And we need to find some new ways to work. Just like Joanna said, we need to think about what is the NHS here for? What services should it be providing? How do we make sure that it gives first-class care to people? I was having a conversation with someone the other day, and they said the NHS seems very reactive and not proactive in terms of when it comes to healthcare and how we access it. So I think there are many, many conversations to be had, but I feel like we're almost being driven into a private healthcare situation because things will get so bad that people will just begin to start self-selecting out of the NHS, and I think that would be a massive shame.
OK, Janelle, thanks for that. Joanna, let's move on to this story that you picked out here. Interesting reporting inside the Daily Mail, and this is about support for striking workers. Just lay out what this latest poll tells us.
Yeah, so it shows that there's some quite big disparities really in the public support for nurses compared to the train drivers, for example. I actually think having public support is really important for the strikers, and I think the union leaders must bear this in mind. And I don't think that means backing down on strikes, but I do think it means being available for media interviews, for example, and actually making the case. So things like that article in the Mirror that we were just talking about, really pointing out why these strikes are important and what's at stake here, and how this, I think, even arguing for a pay rise is very important because it's not just about the workers who are kind of going to immediately benefit, but it's about the living standards of workers more broadly, of everybody in society, and the idea of not accepting wages that we can't afford to feed our families off. I think that's a very, very important principle. But I do think the levels of support for the nurses in particular do seem to be extremely high, and I think that's heartening. It's saying 66% of the public are in favour of the nurses striking, and even among Conservative Party voters, more people are supporting the nurses than are not. And I think the union really needs to make sure that that remains the case. Support has fallen slightly, it's suggesting, for people for the train drivers and the rail workers, but the figures are still fairly high, and like I say, I do think it's important that the union leaders capitalise on this and continue to make the bigger arguments about why these strikes are important.
Yeah, thanks for that, Joanna. And I do want to just move on, Joanna, if you can, forgive me, but I want to stick with Joanna because I do want to pick up the story that Joanna's picked out here in the Daily Telegraph. We just reported it earlier by speaking to Karen Adam. This is about those gender recognition reforms, Joanna. You've picked out how the Daily Telegraph are covering it. Just tell us what the paper's saying.
Yeah, so it's pointing out the fact that children, and I use that word very pointedly, children at the age of 15 will begin to start the process of changing their gender so that they can then apply for a gender recognition certificate in the opposite sex to that they were born as on their 16th birthday, essentially. I have to say, as a mother of a 16-year-old daughter, this concerns me greatly. We do not let 16-year-olds buy cigarettes. We do not let 16-year-olds buy alcohol. And I think there are very good reasons why, as a society, we've made that decision that 16-year-olds aren't allowed to do those things. When I was 16, I changed my mind from one day to the next about the type of person I was, what I was into, and the idea that people can make such potentially life-altering decisions at this very, very young age, I think should really concern all of us. I don't think it's a positive thing. I don't think it's a progressive thing. I also think it's incredibly disingenuous to say that this demedicalizes the process, because we know from statistics, from research that's been done in this area, that social transition, that means just being able to change your name, your pronouns, your style of dress, is highly likely. There's a very, very strong correlation with young people who make that step to socially transition, who do then
Joanne,
go on
sorry,
to
Joanne,
take
I have
hormone
to jump in
therapies.
because we are running short of time. But just to be completely clear, it is at the age of 16, and it's not a transition yet. It's a gender recognition. It's a certificate, isn't it? So it's not a medical process, but
social transition.
Absolutely. OK, Joanne, thank you very much. Janelle, we'll come back to you again in the next hour. I do appreciate you both guys for being with us. Thank you so much.